History as it happens, November 11th, 2021. Heading toward herd immunity.
Today is a great day for American parents, American families, and American children. We've taken a giant step forward to further accelerate our path out of this pandemic.
Our definition of fully vaccinated in the future. But right now, what I would say is if you're eligible for a booster, go ahead and get your booster.
Continue to see a downward trend in cases, in deaths, and in hospitalizations. But we seem to be plateauing at around 70,000 cases a day over the last several weeks.
It's been 2 years since the coronavirus that causes COVID-19 entered the human population. More than 5 million people have died worldwide, 750,000 in the United States. And another winter is coming for the unvaccinated. But the end of the pandemic may be in sight. We could soon reach herd immunity. But what does that actually mean? That's next as we speak to John Barry as we report History as It Happens, a podcast from the Washington Times. I'm Martin DeCaro.
It certainly is some numbing effect, even more frustration because you know that the people who are dying now, the vast majority of them do not need to die.
If I had told you back in March 2020, when none of us knew what was coming, that 750,000 Americans, at least that many, and likely many more, would die from the coronavirus, you probably wouldn't have believed it. Well, some people still don't believe it, and depending on what part of the country you're talking about, the pandemic is basically over, has been over for months now. At least based on how certain public officials are handling it and how individual citizens are acting. Of course, it is not over in hospitals and emergency rooms. That is where the sick and dying go to suffer, the vaccine-resistant, most of them anyway. So we have somehow gotten used to 1,200 fatalities per day. That is the 14-day moving average as I speak into this microphone here in early November. And 75,000 cases diagnosed per day. As a sign of progress, well, those numbers are lower than they'd been during the Delta variant's peak level of the summer. But the worst of this nightmare could soon be past us. Historian John Barry is back to explain what herd immunity is and what the post-pandemic world might look like. But I gotta say, before we get to John, the world we're living in now seems upside down. Depending on which TV shows you watch or social media feeds you're following, you might subscribe to the same definition of immunity as Packers quarterback Aaron Rodgers, who lied to his teammates and coaches and fans about whether he had been vaccinated.
Are you vaccinated?
Yeah, I've been immunized. There's guys on the team that haven't been vaccinated. I think it's a personal decision. I'm not going to judge those guys.
That was back in August during the NFL's preseason, and that statement will go into the same category as this one in this bizarre, tragic chapter of our history.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that, too. Sounds interesting.
We'll get the right folks who could.
Right, and then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs, and it does a tremendous number of the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting to me.
Well, let's not dwell on the past when we could be out of this relatively soon. John Barry is the author of The Great Influenza, the story of the deadliest pandemic in history, which is about the 1918 flu pandemic, and he is a distinguished scholar at Tulane University School of Public Health and Tropical Medicine. John Barry, welcome back.
Thank you.
And this is your third appearance on the podcast. First spoke to you back in February. Have to admit my senses have gone a little bit numb lately when I saw that the global death toll had passed 5 million people. The death toll in the United States is now past 750,000 people. The average, the 14-day moving average, is still about 1,000 Americans are dying every day. These are depressing numbers, but I didn't react the way I might have expected had you told me way back in early 2020 that all of this was coming our way. I suppose it's unavoidable to some degree to feel that way. How about you?
Well, there certainly is some numbing effect, even more frustration because you know that the people who are dying now, the vast majority of them do not need to die. And of course, the death toll worldwide is way understated. I'm sure you're familiar with The Economist, which has been looking at that through excess mortality and, puts it at a range between 12 million and 19 million, I guess was the last figure I saw, and likely 15 or 16 million.
India, for instance, we'll never know exactly how many died in India.
Or Africa. I think the number in the United States certainly is understated, particularly when you get to excess mortality. But yeah, it's bad.
Well, I suppose we shouldn't be entirely surprised because we know through history that pandemics happen. We just didn't want to believe that this one was going to happen.
The case mortality rate is pretty low. This could have been much worse, and the next one could be.
For listeners who maybe didn't catch our initial discussion back in February when we spoke about 1918 a lot, did people get used to the death, so to speak, in 1918? Did it become almost prosaic when that pandemic dragged on?
No, I don't think so. But one of the biggest differences between the two is speed. 1918, worldwide, probably 2/3 of the deaths occurred in 14 or 15 weeks. And in any particular city, it was probably about half that time, somewhere between 6 and 8 weeks, maybe some cases 10 weeks, it would take the virus to move through a city. So it was an entirely different situation. You get numb, but not like we are doing now. This is November. The virus entered the human population 2 years ago, and we've dealt with the pandemic for more than a year and a half at this point.
So you wrote an op-ed, another one, in the Washington Post in early October that we might be on the verge of herd immunity soon. 90% or more of the U.S. population will have considerable but not perfect immunity to the novel coronavirus. Well, as a non-scientist, I think that sounds pretty good. What does that actually mean?
Well, think of herd immunity. Imagine there are 200 cars in a parking lot, and the vast majority of them have car alarms and a lock. So perfect herd immunity would be when a thief tries to break in a couple of cars, sets off a few car alarms, and takes off before he ever comes across a car that is open. That's what herd immunity, if it were perfect, that's what it would mean. We're not in that situation. In this case, let's say people don't turn their car alarms on, but they've cleaned out their car, so there's nothing to steal. So occasionally a thief breaks into a car, but he finds nothing. So there's no real loss other than the broken window, maybe. Then occasionally there are a few people in there who haven't bothered to take any precautions whatsoever, and the thief steals it. And that's like the unvaccinated population. The overwhelming number of deaths, as I'm sure you know, are in the unvaccinated. It's, that simple. I saw a number that said 185 million people are fully vaccinated. And among that number, there have been 7,700 deaths. And the vast majority of that number are over 80 with comorbidities. If you project to the full population of the country, that would be a very mild influenza season. That would be like 13,000 influenza deaths, which would be one of the mildest we could see. So if you were fully vaccinated, you have great protection. You still might get some symptoms, but you have great protection. To everybody in public health, it is so disturbing to see all these unvaccinated people. They're choosing not to be vaccinated because of just absurd, whether it's partisanship, I've seen some quotes, they feel it'd be disloyal to Trump if they got vaccinated somehow. They're crazy.
There's a Reddit thread that I do not look at, but I know some people who do check it daily, called the Herman Cain Awards, which is not meant to be complimentary. It's screenshots of people's Facebook posts declaring the vaccine is BS, or we don't got to worry about this, I'll be fine. There are better ways to prevent yourself from getting sick by taking this or that quack medicine. You get the point. And then as you go down the thread, that same person now is suddenly posting that they're in a hospital and they're not feeling very well, and then they're on a ventilator, and then eventually a death notice.
Right.
Yeah.
How did this become partisan? How did vaccination become partisan? It is.
Well, as you know, of course, there's always been resistance to vaccines and inoculations through history, maybe never quite this way. But I recently did an episode about smallpox and variolation, which was quite dangerous compared to modern vaccinations. Some people did die when they were variolated against smallpox. But there's always been a suspicious anti-medicine, anti-science strain in our society.
Yeah, but this is different. You're talking about a new study that found vastly more deaths in counties that voted for Trump than in counties that voted for Biden. How is that possible? It's just stupid.
So that 90% estimate that you cited in your op-ed, that's a combination of vaccine immunity and then the immunity you have from catching the virus and surviving.
Right.
Vaccine immunity is stronger, right?
It seems to be, yes. The natural immunity does seem to wane. There have been some studies that have said natural immunity looks better, so it's not crystal clear, but most of them confirm that the vaccine, and is very unusual, actually provides better immunity than natural infection.
When we last spoke, you said another variant was likely. If not here in the United States, then somewhere else in the world where COVID is spreading rapidly. I actually saw a headline today that Romania has one of the highest death rates. Is that still the case? That we might see another variant here?
Oh, yeah. I mean, it's inevitable. The question is how impactful it is. I hope I said that before Delta surfaced. Did I?
This was post-Delta that we might get another.
Yeah, my position's the same. I think it's inevitable. Delta has elbowed aside every other variant. It's done so because it is much more transmissible than the others. And it's much more transmissible because its viral load is enormously greater than its predecessors. We're 1,000 times, 1,200 times the viral load. So that does have an advantage in infecting people. So the other variants, which we used to hear about, alpha, beta, gamma, more recently mu, they can't get a foothold. And once Delta infects someone, you have natural immunity. At the same time, Delta is causing some breakthrough infections among the vaccinated, but those infections are not serious as a general rule. You've sort of got almost two separate diseases. You have the disease that infects the upper respiratory tract, which can give you some symptoms, and then you get the disease that infects the lungs. What the vaccines build up is deeper in the immune system, T cells, memory B cells, before the virus can get into the lung in any numbers and cause serious damage. Those parts of the immune system have an opportunity to mobilize and take on the virus. That's why you can get a breakthrough infection, but people aren't dying because it prevents it from getting into the lungs. That part of the immune system takes a while to mobilize. They're not great at stopping an upper respiratory tract infection because there aren't a lot in there. And again, they take time to generate that response. So the question is, after you get roughly 90% or higher of the population infected, then what's going to happen? Even with a variant as transmissible as Delta, in my view, the chances are that it's still not going to get severe disease. It's not impossible, but the most likely outcome is, I think, a new variant will emerge that has the ability to escape the antibodies, the immune protection provided by antibodies, but it won't be able to escape the immune protection provided by the T cells. And that means you might get some cold-like symptoms, but you're not going to get severely ill. You're not going to die. You know, there is a worst case scenario and there's a best case scenario. The worst case scenario is you get a virus that's as transmissible as Delta that can also evade the immune system. And that's more virulent. You know, it could happen. I don't think that's very likely. The best case scenario is, and not to interrupt you, is that the Delta is so good at being transmissible, there's sort of a tropism toward the upper respiratory tract, It's got this tremendous viral load in the upper respiratory tract, but there's no real indication that it's developing that kind of viral load when it gets into the lung.
Keeping it out of the lungs is key. We've learned that.
Right. Although this virus obviously causes problems in the circulatory system as well. But to finish what I was saying a second ago, if you have a virus that focuses on the upper respiratory tract, it could end up becoming essentially a common cold virus. And there is a theory that the 1889 influenza pandemic was not actually influenza, that it was caused by a coronavirus, OC43, that today causes a common cold.
And you wrote that in 1921, the virus that had been so lethal had become seasonal influenza, killing relatively few over the following decades and having no impact on daily life. Did people realize it immediately when this happened? I'm not sure what the state of medicine was in 1921. Did it take people time to realize that the virus did transform into something that wasn't very lethal?
Well, they certainly knew that people weren't dying again. They didn't even know what a virus was in 1918. They knew that there were these very small organisms. They didn't know whether they were tiny bacteria or whether they were a different kind of organism. There are some people who count the 1918 pandemic as having had 4 waves. I think there were only 3, but it's a matter of semantics. Like 1920 influenza season, I consider a severe seasonal influenza. Some people think it was the 4th wave. Fine. But by 1921, the deaths were back to pre-pandemic levels and continued at that rate for the next 40 years.
I asked that question because I assume that today, with everything we know about viruses and with the disease surveillance that we have here and in other countries, we would know if something like that took place pretty quickly, right?
Yeah. I mean, it would certainly be noticed. And in 1918, what happened was essentially what I described earlier as the most likely outcome this time around. You had a variant that escaped immunity because the 3rd wave of the 1918 pandemic, which occurred in the spring of 1919, infected people who had gotten sick in the 2nd wave and the 1st and 2nd waves with no trouble whatsoever, and in equal numbers with those who had not gotten sick in the 1st or 2nd waves. So it obviously had the ability to escape the immune system, but it was much less lethal than the 2nd wave. It was still pretty lethal, but it was less so. And then that same trend continued for the next couple of years.
So what I'm getting at here with my questions is, what is this all going to look like once we're past the pandemic? 90% herd immunity, you already explained that. It's not quite as simple as it sounds, and potential for new variants and whether they'll get into your lungs or the upper respiratory tract. What's your answer to folks who are wondering, what does post-pandemic, not post-COVID, because it sounds like COVID's going to stick around even if it's not very lethal, but a post-pandemic world, what's that going to be like?
I think we'll come to it slowly. Even number one, my expectations, I'm actually pretty optimistic now. I think that once you reach the very, very high, either vaccination or recovered from infection, the virus is not going to be causing severe disease. You may get a lot of cases, but I think the focus is going to need to change to the death count, not the case count. And I think that will drop significantly. People are going to be cautious. Perhaps some would be overcautious. Right now, I'm willing to go inside for a restaurant, but I was going to meet somebody on Saturday who is not comfortable. I think that's a very reasonable position to take right now, but she's extremely cautious, and I believe that she'll probably be wearing a mask indefinitely. I still wear a mask, and I'll probably continue to do so while I monitor case counts wherever I am. I think it would be a slow process with people becoming more comfortable taking their masks off and eating inside and so forth and so on.
And people will, in certain numbers, continue to get sick from this, but it might be like the flu insofar we know every year that some people die of the flu, between 10 and 50,000 Americans, depending on how bad the flu season is. We'll have it in the back of our heads that, yeah, you can catch COVID-19, but if you're vaccinated, you should be okay.
Right. Exactly right.
I guess it's impossible to know how many people will die every year from COVID-19 in 2, 3, 4, 5 years down the road, right?
It's totally impossible.
Yeah. My partner and I have yet to return to restaurants, indoor dining, with one or two exceptions. Actually, right before Delta hit, we went to a really nice restaurant. And we're not afraid of dying, but I just don't want to get sick and miss days of work, right? I want to continue to produce my podcast. But, I mean, that's life, right? I mean, I could catch the flu, I can catch whatever.
Well, you still have long COVID to worry about. Back when the Great Barrington Declaration came out, I wrote an op-ed at the time as to why that approach didn't make any sense. This is, remember, before we had a vaccine. One of the reasons was we don't know anything about long COVID, that people who have a very mild case, in some case asymptomatic, still develop long COVID. We don't know how severe that is, what the long-lasting impacts are. And one of my points in the rebuttal was, why would you expose several 100 million people to an unknown risk like that? You know there's a risk. You don't know how big it is, but why expose people knowingly when that can be avoided? So it's still something to be concerned with.
And as we speak, the pandemic isn't over yet. But of course, just about every day you'll find an article on either side of the issue about who handled it better, who handled it worse. In Florida, which was a subject of discussion the last time we talked to each other, the governor there and his backers are basically touting success, even though close to 60,000 Floridians have died during the pandemic. Their case numbers have come down significantly, but they were up at such a high level just a couple of months ago with so many people dying, but they're saying they did it the right way.
I think that's nonsense. There are unnecessary deaths. You do weigh economic activity and collateral damage against deaths, but there was absolutely no reason to take the approach they took. It was purely political. The anti-masking attitudes, the refusal to allow cities that wanted to be more aggressive to be more aggressive, it's just pure politics. And he wasn't playing with people's lives, DeSantis. His policies killed people. I don't see how you can disagree with that.
Beyond Florida, do you get the sense that people are running out of patience with restrictions?
Oh, clearly, so am I. But again, to pass laws that forbid you to have a mask mandate or to require a customer to come into your store with a mask, I thought if you're for personal freedom, you should be in favor of letting any business decide for itself whether they want to require a mask rather than mandate that they can't. That is a political statement that runs counter to every principle they supposedly stand for, not to mention increases the risk to people. He's running for president. What can you say?
You said you were pretty optimistic about how things are going now. What about the rest of the world? I guess we really can't talk about a pandemic and only focus on the United States. I know that some places in China are still locked down. I know that Australia continues to be really strict about things. But are there places where the virus is spreading rapidly that have you concerned?
Yeah, well, Eastern Europe and Africa. China is the only country left that is still trying to eliminate the virus.
Yeah, zero COVID is, I guess, what they call it.
Right. New Zealand and Australia have given up that approach. China continues.
Do you think that's possible?
No. I mean, it's possible to continue the measures that they have in place. That will go on indefinitely. They use Chinese vaccines, which are not as good vaccines. They'll get over it eventually, but they'll also, if they want the zero COVID, they're going to continually close down big cities. They can do it. They're an authoritarian government. They can do what they want. They have the power.
Well, it's a police state, and that didn't fly here. But I should say that we didn't really do that here. Businesses were closed for a short time in 2020. I'm not sure I'm right about this. I'm no scientist. But maybe among the lessons we learned from this pandemic, maybe we learned that we can keep businesses open as long as everyone's wearing masks. That masks go a long way towards protecting people without having to do extensive economic damage. Am I way off on that?
It's not clear, and I think it would depend on the virus, how it's transmitted, and so forth and so on. Masks are a major help. They are not a be-all and end-all. You are still going to transmit virus and you're still going to get sick wearing masks. They're, certainly not as good as vaccine. They are an important tool. That's all they are, which is a lot. There are times when you are going to want to close things down. It depends on the virus, how severe it is. If we faced a 1918 type virus, number one, you wouldn't have had the political opposition, because one of the other differences between the viruses, it's a higher case fatality rate in 1918, and young people and young children are dying. So if you see your neighbor's 4-year-old child drop dead and another neighbor's 24-year-old spouse die, then it doesn't matter who says this is not serious. You are going to take it seriously. That's what happened in 1918.
I get the sense that because early on in the COVID pandemic, because it was primarily really old people dying in nursing homes, that gave people some kind of...
That's exactly right. And to be perfectly honest, I'm over 70. To be perfectly honest in terms of what kind of measures you take, that is something that you factor in how many years of life are lost. When you triage, you have to take all sorts of things into account, including issues like that. But plenty of younger people died. Out of the 750,000, there are a lot of people under 65 who died. A lot.
Well, nowadays, people in their 40s who are otherwise healthy.
Right. The elderly have much higher vaccination rates. Even in strongly Trump counties, you have very high vaccination rates among the elderly. So it's the younger people who are less likely to be vaccinated.
I appreciate your answers, because nothing is certain. As I listen to you, there are no certainties or definites or 100% as we move along here. And unfortunately, many people approach this subject like there are certainties or that they know what they're actually talking about. I'll be the first to admit I don't, but I try to listen to people like you and medical professionals who do. Moving ahead to the next one, whenever it comes, and we know there will be another one, the way we've handled this one does not bode well for our country.
Obviously, that's true. I think it really comes down to the messaging at the beginning. This not only could have, but certainly should have been handled very differently. The undermining of the public health community and the scientific community, the dismissal of scientific advice. Again, economics factor into how you respond. Collateral damage factors into how you respond. The response should not simply be dictated by the virus. You have to look at the whole picture, but that's not what happened. The whole picture was not considered. Only a political campaign was considered, which was counterproductive. Even in the future, political leaders who were solely guided by their self-interest and their political future can look back at political leaders this time around who downplayed the pandemic, and they all suffered for it. Bolsonaro in Brazil, his popularity is tanked. I think Trump pretty clearly lost the election because of his response.
Agreed.
To the virus. So, that could be a lesson too. And maybe next time around, because those who downplayed the attack suffered for it politically, then it's in the self-interest of any country's leadership to do a better job in the future.
John Barry, we thank you for returning to the podcast and for the work you're doing to keep people informed about this pandemic. On the next episode of History as It Happens, CRT.
Critical race theory is a way of thinking and teaching about America's past and present by looking at the role of systemic racism.
Sounds innocent enough, right? Well, critical race theory somehow, some way became one of the most hotly contested fronts in our culture wars. Although a lot of folks aren't sure what it is or if it's really evil or if it's even taught in public schools. We're going to try to understand what this is all about when we're joined by the great Eric Foner next as we report History as It Happens, a podcast from the Washington Times.